That was some good stuff. That was a good analogy. So aside from just the chamber therapy, you guys also do a lot of wound care at RevitalizeMe.
Yeah.
So you're saying, if someone comes with an infected wound, would the first step be to clean that wound out before they get their hyperbaric therapy, or what's the steps for that?
So doing standard therapy for wound care involves antibiotics if there is signs of infection. It includes offloading. We don't want to keep pressure on the area because that also will close off blood vessels and reduce blood flow to the area and reduce nutrients. In addition, send patients to get vascular workup. And what that means is typically they'll go get ultrasounds and imaging tests under a vascular surgeon's office to check the blood flow, and we want to see, can we restore even more blood flow to the area to help support that wound to heal. And that goes back to sometimes those vessels are too narrow in the lower extremities, and that's where hyperbaric can support that new blood vessel growth or angiogenesis. In addition, we do debridements, and this essentially is going into wherever there's a wound, and we clean out the devitalized tissue, areas that are either some dead tissue, scar tissue, and this helps stimulate the base of the wound to provide growth factors and stimulate growth factors to come up and encourage that wound to heal.
Right.
So it's the analogy is like you're prepping. It's almost like you have a garden and you go in, you're cleaning out the weeds, you're cleaning out the bad tissue, you're taking out any dead plants in the area. You're prepping the foundation for fresh tissue to come in and grow.
Right. So you kind of have to do that work first in order for the hyperbaric to have its full effect.
Well, you typically would do it in combination, yeah.
Okay.
Yeah.
Interesting. That was some good stuff. That was a good analogy.
It was good. That was off the rip.